Good morning, everyone. Some parents have raised concerns regarding the mask-wearing policy for students while in school. Some feel that our coronavirus testing in schools is sufficient to ensure the safety of our students and our staff, and they are requesting that children be allowed to remove their mask while sitting at their desk. Unfortunately, testing alone will not protect our students, our teachers, and our staff, and removing their masks while sitting could increase transmission. I want to remind members of the public that there's a difference between detecting the coronavirus and preventing the spread of the coronavirus. Testing for the coronavirus is designed for early detection, not prevention. Wearing a mask while indoors is an essential layer of protection to prevent the spread of the coronavirus. Again, there is a distinct difference between detection and prevention. As children head back to the classroom in the middle of a serious outbreak, the Ministry of Health is working very closely with the Ministry of Education to protect the health and safety of our students, our teachers, and our staff in all of our island schools, and we are using multiple layers to provide the greatest level of protection. Our layered approach is similar to wearing a hat, a scarf, gloves, and a warm coat in freezing weather. Each layer provides an added level of protection from the cold. The pandemic is far from over, and while the vaccine is the most effective protection available, masks, when worn correctly, effectively reduce the spread of the coronavirus in our schools. To avoid scenarios where classes have to go to remote learning just as the school year begins, as I said earlier, our approach to keeping our children, our teachers, and our staff safe from the coronavirus is a layered approach, which includes the following: encouraging all eligible teachers and students to be fully vaccinated, encouraging all families to participate in the Saliva Screening program, maintaining appropriate physical distancing, at least 3 feet between students within the classrooms, avoiding poorly ventilated areas, frequent hand washing, covering a cough or sneeze, cleaning and disinfecting touch points, and of course, consistent and correct mask use inside our schools regardless of vaccination status. Masks significantly protect both the persons who are wearing them and the people around them. Wearing a mask will also help decrease the number of symptomatic respiratory illnesses that children have. This is especially important for students, as children under 12 are unvaccinated. Children have been involved in the start of the present outbreak, which is driven by the Delta variant, which now has over 200 positive cases. And infected children can take the virus home to unvaccinated friends and relatives. Over the summer, we had 4 summer camps and child care settings affected with positive cases, mostly the Delta variant, which is highly transmissible. In quite a few instances, these children went home and unknowingly passed the infection to someone else in their household, and subsequently this led to positive cases in the workplace settings as well. Similar clusters of cases in schools can occur if protocols are not followed, such as wearing a mask. The government of Bermuda is taking a cautious approach, which is prudent at the start of the school year, given that we are currently meeting the criteria for community transmission at concerning levels. Again, the main goal of these preventive measures is to protect students, teachers, and staff, and to provide a safe learning environment in support of the Ministry of Education's mission to start in-person learning, as this is best for all of our students. And I cannot stress enough that our children's well-being and safety is our main priority. We believe that our prevention strategies, if strictly adhered to, can maintain in-person learning even during high transmission levels of community. As a community, we all want what is best for our children, and in-school learning is desirable, certainly, and that should be our objective. In closing, I want to remind all teachers, staff, and children that they must stay home if they feel unwell or have symptoms. Symptoms which can easily be associated with allergies or a mild cold, stuffiness, tiredness, headache, coughing, and sneezing. If you have any questions or feel unwell, please contact the COVID hotline at 444-2498 or visit gov.bm/coronavirus. Thank you.
Good morning, Bermuda. As we prepare to reopen Bermuda's public schools on Thursday, September 9th, we are excited to welcome our pre-primary, middle, and senior school students as safely as possible. Although we are still navigating a global pandemic, both the Ministry of Health and the Ministry and Department of Education have been diligently working to ensure that the safety of our students and staff is thoroughly prioritized in our safety and health protocols and guidelines. While there's been some uneasiness in the community regarding the measures we are taking, I want to thank the Minister of Health for clarifying the importance of these measures. I completely relate to COVID-19 fatigue that many of us are experiencing as we are eager to be beyond the pandemic. However, we cannot allow this feeling to catch us with our guard down by lowering our defenses. I reassure you that both the Ministry and the Department of Education want our schools to remain open, as during the past 2 academic years, our students and staff have endured enough interruptions. We recognize that when children are not in school full-time and engaged in face-to-face learning, this is directly associated with a decline in health, well-being, and educational achievements. Further to this, we recognize the strain this puts on our parents, their households, our economy, and many are unable to go to work when this happens, and our country as a whole. Thus, we have to push forward with doing what is best for our students, staff, and the country. The main changes in the protocols is that they are now based on the status or phase that the country is in with respect to the case data. Presently, Bermuda is in phase 3, imported sporadic cases. And during this phase, our schools have many of the same protocols as last year. However, there are some changes. As the Minister of Health outlined, schools will continue daily safety measures such as entry protocols, physical distancing, hand and respiratory hygiene, good ventilation, and disinfecting of equipment, furniture, and high-touch areas. 2 changes I'm sure our students will be happy about are physical education and field trips. For physical education, each class bubble is to remain separate from other bubbles for indoor classes. However, 2 class bubbles in the same year level can have outdoor PE classes together. Also, we know that our students love the opportunity to get out and explore. And in this phase, field trips have been allowed to resume with 1 class bubble per minibus. Guidelines will include wearing face masks and practicing good hand hygiene, along with good ventilation on the minibus. Students and staff must follow the protocols and remain separate from other groups or individuals at the field trip location. A significant change from where we ended last school year is that both staff and students at the P4 to S4 level will be required to wear masks when indoors. As the Minister of Health stated, wearing a mask while indoors is an essential layer of protection to prevent the spread of the virus. And while some parents do not feel that this is ideal, for the reasons provided, it is necessary that we comply with this protocol. To review all of the COVID-19 protocols by phase, we encourage you to visit our website, www.moed.bm, and as they have already been shared with staff and will be shared with parents. As you should recall, as another measure of safety last year, we introduced the Saliva Screening program and will continue with the program this school year. Through this program, we are working to mitigate some of the unpredictability of the COVID-19 virus. The MDL lab organizes students at each school in groups for bi-weekly screening, with each student being tested once a month. Screening groups of students bi-weekly will provide MDL with samples across classrooms and will help mitigate any COVID-19 risks in the school on an ongoing basis. Once MDL secures the saliva samples, the results are available within 24 hours. The results of the saliva test are sent directly to the parents, not the school principal or the Department of Education. If a positive test is detected, the results are sent to the individual's physician and followed up with a nasal pharyngeal test. The Department of Health will alert the Department of Education of a positive result and then conduct a risk assessment at the affected school. The Department of Health will use this assessment to determine what additional measures will need to take place at that affected school. Staff who consent to participate in the program will be scheduled for screening based on the frequency of their interaction with others. For example, a member of staff who interacts with many different students and other staff would be screened weekly. Staff members who have contact with only some students and some staff will be screened every 2 weeks. And lastly, staff with few interactions, such as with one class or would be screened once a month. Routine screening of staff and students increases the chance of detecting the virus at a moment when new infections are occurring or have just occurred. It also helps to identify anyone who may have contracted the virus and be asymptomatic. Screening benefits our schools as well as our country as a whole because it will assist in avoiding large-scale outbreaks in our school system that could result in school closures. We encourage all parents to sign up their children for the program by completing the parent consent form, as no student can participate in the screening program without parent consent. We are strongly advising parents to consent to the screening program for their children. With our current COVID status and the fact that children are showing up to be as affected as adults, the screening program is a much needed additional layer of protection. The saliva screening is non-invasive process, and from our data, students are not opposed to it. Parents, please help us keep our schools safe and fill out a consent form. At this time, we're going to play a video of the screening so you can have an understanding of the process.
COVID-19 screening is vitally important for the safety of our children in the coming school year. So during the 2021-2022 school year, there will be bi-weekly screening at the schools, and an optional COVID-19 saliva screening will be offered for each public school student on a monthly basis. The screening is a quick and easy saliva screen that will be done by the schools, and your participation is strongly encouraged for the public health of Bermuda. 3 types of saliva screens will be offered. The second screen requires a saliva sample provided under the supervision of the lab tester. It works as follows. The lab tester removes the saliva screening kit from its packaging. The student is asked to deposit a saliva sample into a tube containing a safe preservative. The tube is then shaken several times, labeled with the child's information, placed in a bag, and sent to the lab for processing. The student may not eat, drink, or chew gum for 30 minutes before testing. If they have done so, they will have to wait 30 minutes before starting. That is all that is required. We encourage all students to be signed up for the screening. To sign your child up, please go to the web address that appears on your screen.
It is a very simple screening method, and informational videos of all 3 screening methods can be accessed on the Ministry of Education's website, YouTube, Facebook, and Instagram accounts. While some may feel these protocols and guidelines are not ideal, the safety and health of our students and staff is something we should not be willing to sacrifice. Nor should we find it acceptable to have our students and staff experience constant disruptions to learning and teaching. Our students deserve to be in school, with their teachers, with their peers, learning and socializing so that they can thrive well into their futures. Having our parents forced to take on the role as educators and our children isolated is far less ideal with much longer-term implications. It is our hope that parents, teachers, school staff, and our country as a whole will continue to support what is necessary and best for our students, as they are our future, and it is imperative that we continue to make decisions that are in their best interest. Thank you.
We'll take questions from the media. We'll start with the Royal Gazette.
Thank you. Good morning, Ministers. First question is for the Minister of Education. Minister, you said that we're in phase 3. Given the number of cases that we've had in the last week or couple of weeks, the increasing number of cases, isn't phase 3 a little optimistic? Wouldn't you have thought we'd be in phase 1 or phase 2?
We take our direction from the Department of Health, and the Department of Health has told us that we will enter into the school opening in phase 3. If that changes between now and then, we'll make those adjustments.
What's your own personal view there? Do you think phase 3 is the correct phase?
My own personal view is that the advice from the Department of Health is good enough for me.
Okay, thank you.
Can I add to that? Our WHO has classified Bermuda, as you know, with sporadic cases. We are looking at the ground of what the position is. However, our WHO classification is sporadic, but locally we are looking at what the recent status has been with respect to our cases, and we're monitoring that very closely.
Sure. But on Monday, the CDC raised Bermuda's level from 2 to 3,
That's
from
correct.
medium to high.
Correct. Well, the ratings of the CDC have nothing to do with WHO. That's an
Sure.
internal process, and they decide what advice they need to give to their citizens of America with respect to traveling and so forth.
Sure. Okay. And my next question to you, Minister. You talk about these clusters of cases that we've had in summer camps throughout the summer, and there are a growing number of cases amongst children, under 10, under 19. But you said that if schools and students and teachers follow the guidelines, then they should be safe. There won't be any risk.
Mm-hmm.
But isn't that a big if, particularly when you're talking about children? Because clearly it didn't work during the summer because, lots of clusters of cases in summer camps.
Yes. I'm sorry.
So how can you be sure that schools aren't going to become a breeding ground for the virus? I mean, why not just say, okay, let's go homeschooling for the first couple of weeks, see how we get through this next month?
Well, as you've, we've made mention of the fact that it is critically important for the best well-being of children for them to be socialized and to be in classrooms. I know my son was homeschooled at home last year during the pandemic, and it was not something that he enjoyed. And I know there's a number of children that feel likewise. So the best optimal position for children to thrive socially and educationally is within the classroom. However, which is why we're deploying our parents in particular to assist us with respect to ensuring as best as possible we are able to allow children, staff, and teachers to return to the in-school environment as safely as possible. And by that means ensuring that they are wearing their proper masks so that they can help prevent the spread, and likewise doing the other actions that we've spoken about to help mitigate. But likewise, it's also critically important for persons to be screened, because if an individual knows that they are carrying the COVID virus, then other precautionary measures can take place because that person has the knowledge, which is critically important, which is why the Minister of Education is, as well as Health, is imploring parents to ensure that their children do have the proper screening if they're underage and cannot be vaccinated, which of course
Sure.
is the best.
Did you get that same message out at the start of the summer when schools broke up? And I mean, I must admit I don't recall, but or do you think you kind of missed the boat on that one, and that's perhaps why there's been these clusters of cases?
Up
summer
until
camps?
probably, I don't remember the exact date, but maybe end of June, we were having regular press briefings, as you can appreciate. And myself and the Minister of Education on some occasions, but certainly the Premier, and repeatedly we spoke about the messaging of importance of persons mitigating against the coronavirus, staying in their bubbles, staying protected with respect to the mask wearing and the like, and in particular the issues as it relates to travel, and of more importance is if you're sick to stay home. So that messaging has been, I know I sound like a broken record, so if you're asking, yeah, you're nodding too, I agree, because we've been saying it for 18 months, but we will continue to repeat it and drive home that messaging.
Okay, thank you. One final point. We haven't had a COVID press conference for quite some time. The Premier said that yourself and he won't be attending any more press conferences. There were, of course, some COVID figures released last night. We would really appreciate the opportunity to ask you a few questions about them. I've been told that I can't ask you questions about those figures at this press conference, but once this press conference has concluded, would you be able to spare a few minutes to ask some questions?
Okay, the Premier did indicate that we will be discontinuing the COVID press conferences in the format previously, but what we did say is that we will continue to have technical briefings, and I will also be present with respect to providing statistics and the like. So if you want to just shoot an email to Honey, who's standing behind you, about any questions concerning yesterday's statistics, that would be fine. But we will be continuing to have technical briefings, and they'll just provide a different format with respect to the release of the information.
But you're not willing to spend a few minutes after this press conference answering a few questions?
I may be able to. I don't have all the data from me because I'm prepared for today.
They're not technical questions. They're just on policy.
Okay, that's fine.
Okay, thank you so much, Minister.
Mm-hmm.
Thanks. We'll now hear from your broadcasting.
Thank you very much. Good morning, ministers. So, to note, you mentioned that mandatory mask wearing in classrooms will be for, was it P4 and above?
P4 and above, yes.
So, looking at the CDC's recommendations in the US, they recommend universal mask wearing indoors for all students and staff 2 years and above. But the virus shows no discrimination with regard to age, as shown by the number of children among recent cases in Bermuda. Why are you taking the softer approach when it comes to children in P3 and below, where they are just as likely to transmit if anyone gets the virus?
And thank you for that question. As I stated within my comments, the Department of Education works very closely with the Department of Health, and the determination from the Department of Health was that from in phase 3, phase 2 and phase 2 and up, mask wearing for P4 and up is recommended. If you look at the guidelines, if we ever get, God forbid, we ever get down to phase 1, mask wearing will come into effect for all students within our classroom. And so that's the technical advice that we get from the people who who actually look at this and tell us what is the best way forward, and that's the advice that's being followed.
Okay. Well, then I'll move that question to the Health Minister. We are in right now in Bermuda, the rate of transmission is going up. It's gone up continuously for the last month. Back then we were like 0.2, 0.3. Now we're at 0.8% of tests coming back positive. Why are you not mandating mask wearing across the schools out through all classrooms at the moment?
Gary, at this point, it is a very fluid situation, as you can appreciate. And the one thing I've mentioned this previously that's pretty much certain about COVID, the only thing certain is the name. I mean, the reality is things change quite rapidly. We continue to have dialogue not only with the Minister of Education, but also internally as it relates to the status. We'll be having another case meeting today concerning cases that may or may not have materialized over the last 24 hours. So we're continuing to watch the space. And if circumstances change, and they may change very, very quickly, then there will be recommendations made to the Minister of Education to change the phases.
Okay. And could I just confirm, the saliva screening, is it mandatory for staff?
The saliva screening can only be administered if consent is given.
So staff themselves would, teachers do not have
staff
to
and
do
parents, as I said in the statement, staff and parents have to, they are required to give consent to participate in the saliva screening program.
So you're implementing saliva testing, but it is not mandatory, so people can choose whether they do it or not. Doesn't that render the whole program in some ways void, because one family, one member of staff that chooses not to test could result in an entire classroom being quarantined, or worse, catching the virus? By not making that mandatory, are we not exposing families, staff to more potential risk?
Gary, in the terms of making it mandatory, it is something that we are looking at, and how we can make this process easier to sign up for, and we'll continue to look at that and how we can implement it within our system so it's much more effective. But I can say that it was effective when we introduced it as a pilot last year, because we ended up catching some students who were asymptomatic, and that enabled us to not only go with the regular route of waiting till they're symptomatic and then shutting down a whole class and such. We were able to pull them out and isolate them and get them ahead of time. So it has proven effective. even if we haven't had 100% consent filled out. But we will continue to push and educate the public on how effective it is and why they should sign up for it. And hopefully we will get to those numbers of 100% that we really do want to get to. But at the moment, unfortunately, it is not something that we can mandate to be done.
Okay. And just a note, though, making a comparison to last year in some ways is now not entirely apples and apples, because as the Chief Medical Officer himself has said, we're almost dealing with a different virus when we're dealing with the Delta variant. Wouldn't that
Yes, I completely agree. And again, this is why we've been pushing this for the last couple of weeks for the consent to be done. We're pulling out all of the stops. We've just produced these videos to show parents so they can have an idea of what it looks like when the child is actually being giving the saliva sample. There are two options. They can be either supervised doing it or they can do it themselves. And so we are hoping to get the pickup and get to that 100%. But we'll just continue to push that. And if the situation changes, if we are able to change something in the policy moving forward, we'll make that announcement in due course.
But just to ask directly, would mandatory testing prevent more virus transmission than voluntary testing, yes or no?
Nothing in this is 100%, as the Minister of Health stated. This is the only thing consistent is the name. So we can have 100% and still not prevent. But the closer we are to 100%, the more likelihood that we will prevent something from happening. So that's why we keep pushing.
And you also said that the program is designed to test every student who is volunteering for testing, is to test every student once a month. Is that enough at this time?
Well, based on the program that was put together and given to us, it is. I'm confident that it is. And again, as situations change and as we change the policies, these things will be updated and made known. But at the moment, that's where the lab has come back and said this is the best way to test, and we're doing that. Also, remember, this testing is not just at the public school level; it's at the private school level as well. And so you're looking at literally close to 8,000 tests being conducted on a regular basis within our school system, then both public and private. So that is a lot. That's quite a lot of people to do.
Okay. And last week, Bermuda Broadcasting heard from an infectious disease doctor in Massachusetts. He made a comment about those who are strictly anti-vaccine. Now, this is not in reference to the vaccine hesitant, but to those who are determined to never take the vaccine and campaign against it. He said, quote, "Those people, for example, should not, in my opinion, be allowed to be healthcare providers, should not, in my opinion, be allowed to be working with at-risk people in nursing homes, or potentially even working in schools where they could potentially put people at risk." End quote. What are your thoughts on such a position?
I don't subscribe to such a position because it's your personal choice to take the vaccination or not. It is up to us as the government to continue to continue to show people the advantages of doing such. And so we'll get to a point, I'm sure there will remain people within our country that will never be vaccinated ever, but fortunately there are people who do believe in vaccination, and we'll continue to push forward with that. But I cannot support removing someone from teaching because they refuse to be vaccinated. That just doesn't sit well with me at all.
Thank you. And my final question would be, with what we've seen this summer, some transmission within camps. We know that this virus the Delta variant is incredibly strong and incredibly efficient at transmitting. Do you think the measures you're putting in place today are strong enough to prevent us being back here in a month's time talking about which school groups are on quarantine with multiple families having to miss work? The short answer to that is yes.
explanation answer to that is we can only put things in place to combat what we have in front of us now, and we can then look to always continue to monitor what we have in place and make the changes as needed, as different as the situation in front of us changes. But as we stand right now, from the advice from the Department of Health in collaboration with the Department of Education, we are in a good place.
Okay. Thank you, Ministers.
Thank you, Vivian. Bermuda Rio? Thanks, Sheila.
Yes, good morning. Just so I'm clear, during the summer day camp period this summer, what phase were we in? Were we in phase 2 or phase 3?
Which phases are you referring to?
In terms of mass and screening and requirements for summer day camps, protocols?
I cannot speak to summer day camp protocols because they don't fall under the Department
Okay,
of
well,
Education.
go ahead.
The phases that you're referring to are the phases that have been the COVID guidelines introduced for
Right.
the return of school
Yeah.
for this upcoming school year, and they were released last week.
Okay. This website has spoken to several summer day camp people who said part of the contribution to the spread were regulations by the ministry requiring requirements to actually be licensed, including the fact that when a certain amount of groups in summer day camp, when they're inside, there could be no more than 14 in any one group per se, but all of them could get on the bus, the minibus, to go on a tour or whatever. I noticed you said today that P4 to S4 students will be required to wear masks whilst indoors because it's necessary. But would you say that maybe was a misstep, letting, if you're required to sit inside apart and then get on a minibus all together? One teacher contends you had mixing of bubbles, children coming with no mask, and so forth. Do you think that contributed to the increasing number of children coming down with this virus?
I think, Ciela, from what you've indicated, if people are not wearing masks, then that certainly contributes to the transmissibility of the COVID, particularly the Delta variant, which is why our messaging has always consistently been, please continue to wear your mask. With respect to the minibus scenario that you spoke about, I can't speak to that. As I understand it, you're not allowed to get on a minibus without the wearing of the mask, and that it's pretty much strictly adhered to by the drivers. And with respect to the summer day camps, as the minister indicated, the phases that we spoke about a few moments ago relate specifically to the phases of reopening school. Summer day camps were monitored. They were provided with regulations. They had to be licensed. They were checked on a regular basis to ensure that they were adhering to the COVID protocols that were established by the Ministry of Health.
Okay, I'll put my next few questions all in one. I'm not sure who they go to because they're interrelated. And this was a question put to me by a school teacher with children in the education system who contends that the ministry is blatantly got one set of rules for teachers who have been vaccinated and teachers who are not. And she's asking for clarification on that. When we've seen that students, can spread this virus as well. She says she knows of one family that got sick just a few days after being vaccinated. Can you let parents know where they can find the scientific peer-reviewed studies showing masks work to stop the viral transmission of this virus and are effective and cause no harm to young children? Because she has a 7-year-old who has to mask all day inside, and when they're complaining of things like headaches and not being able to focus. So that's the first one. You want to go there first?
Sure, thanks, Ciela. There has been a number of peer-reviewed studies as well as a lot of information based on evidence that can be found not only on the Public Health England website, as well as the CDC website, as well as the WHO website. So there's quite a substantive amount of evidence that supports the benefits of wearing a mask to help to prevent or minimize the spread of the COVID disease. So I'd invite those persons to go to those websites.
Okay, this teacher is contending that you're segregating teachers, vax versus non-vax. Is that true?
You'd have to explain what the segregation is actually, what they mean by segregation.
Okay, I'll follow up on that later. When are you going to remove the mask requirements on our children? She says because all the phases have masks, and where can she find the peer review studies? I just asked that. She notes that the UK government public health in England has done away with the mask policy in schools since last May. Why is Bermuda still continuing? And finally, she questions the logic when workers go to their jobs and don't wear masks on the job while working with others. But our students, the young kids, have to sit 6 feet apart in a bubble, masked all day, unable to talk coherently or see their teachers and peers' faces, expressions. She wants you to know that teachers are angry and they just want to know what's up. So you can't say when masks are going to be lifted because this thing is fluid.
As we've said repeatedly up here, that the guidelines are constantly reviewed,
Right.
and changes will be made with them as the situation in front of us changes. So if the situation goes to a point where we don't have to wear masks, then we'll look at it
Okay.
at that time.
And
In terms of teachers, I'm not sure. We haven't received any complaints from the Bermuda Union of Teachers.
Okay.
To the level that you're saying, and I'm
Okay.
sure, and we do maintain an open dialogue with the Bermuda Union of Teachers to discuss things such as this, and so I'm hopeful that if there is, in fact, some issues out there, that we'll get that information from them, and we'll be able to address it at that point. Again, and then going back to your terms of vaccinated teachers being treated differently from unvaccinated teachers, that's something that I would need to have more information on, because
Okay.
as far as I'm concerned, all of the teachers are treated identical. There is differences with travel policies,
Yes.
but that falls outside of education.
Okay.
If I do know our policy is, if you've traveled, as schools are considered medium risk, if you've traveled, whether you're even if you're vaccinated, you cannot come back into the school until after your day 4 negative test. If you are unvaccinated, it is after
Day 4.
day 4. Is unvaccinated is day 4 as well.
Both.
Both are. You cannot come into school until after your day 4 negative test. So that means everyone's treated the same, and that applies to students who are vaccinated as well.
Just final question. Some parents have questioned the fact that you waited till now to say what the protocols were or are going to be, when they felt that they should have been informed sooner. But I'm guessing because this is fluid, the closer the better. Yes.
Actually, that is something that has been mentioned before. I don't quite grasp that. School hasn't gone in. The policies that we're instituting now are almost identical to what we finished the school with. There's no requirement to make any adjustments, except for the fact of, because all students arrive at school with a mask on.
Right.
The only difference is now P4 and up will keep that mask on, whereas P3 and under will be able to take it off. So I'm not sure why there would be so much about that. But I also do want to mention that built into the policy is what we call mask breaks. And students are allowed to remove the mask for a few minutes or a few seconds or whatever to get a bit of fresh air. Also, our classes, when we talk about ventilation, that is windows open, so we always got the cross ventilation and stuff. So different things have been built in to make this more comfortable for our students. It's not, as we spoke about, it's not ideal, but it is something that has to be put in place so we can keep our schools safe and keep our children safe, and more importantly, keep them right there where they're able to learn.
Okay, school starts.
Sorry.
Just to finish off, school starts on a Thursday. You've mentioned we've had disruptions for 2 years. I know they work it out according to the number of days for the total school year, but why start on a Thursday? Why not just hit hard on a Monday? Well, after the holiday, obviously.
Well,
you missed a lot of school.
The thing is that, interestingly, you've answered your own question.
Right.
But I'll reiterate that.
Right.
The number of days in school are set.
Yes,
And-
but considering how many days you've missed over the last 2 years, surely you got room for 5 extra days.
As I stated, the number of days that our teachers are employed is set by the CBA, and that's that's how the schedule is put together. We can ask them to teach extra days, but we put the schedule together based on the number of days that they're required to be in school, which I may add averages one of the highest in the world.
Seal, just to clarify something concerning you had asked the question, as I understood you, the distinction between unvaccinated and vaccinated teachers returning, but recognizing the law as it stands now, if you're returning and you're unvaccinated, then you must quarantine either at the hotel facility and then at home, but there is still that requirement to quarantine.
Noted. Thank you.
Thank you, ministers. Thank you, members of the media. That concludes our press conference.